Well, good morning again. Thank you. Thank you so much for listening. I share with you in case they're about meeting objectives for the. Please know that we're trying to do our best to get you the clinical at the bedside time that you need. In case I'm at the bedside time, Board of Registrar or the governor's office has the bill right now to extend the simulation time. What I did want to do, let me share my screen with you for a second here. There we go. I wanted to show you, this is something that the second semester faculty has been working from. Basically what we did is we took each course in the series, theory, clinical, CRS, and skills, and we mapped out all the SLOs as they currently stand. So I wanted to focus for a moment on the uh, student learning objectives. So these are not the program learning objectives. These are the student learning objectives for each second semester course. So the first objective is that students will complete 2 nursing care plans or concept maps for 1 maternal newborn client and for 1 infant, child, adolescent, young adult client. So that would be you guys, infant, child, adolescent, young adult client. The plan of care includes 2 nursing problems, based on interpretation of developmental stage, individualized nursing, interprofessional interventions, and evidence of evaluation of care provided. That is incorporated into your care plan care map. So that SLO can be checked off for that portion. You would still have to do one for the maternal newborn clients. I think that actually ends up being 2 because it's 1 for the mom and 1 for the baby. You're halfway there with that SLO. The second student learning outcome for clinical is using the clinical portfolio communication tool. The student will articulate communication interactions between the student. Let's take the healthcare team member to advocate to meet the client's unique needs would be advocating for your client. And then also interactions between the student and a client, which illustrates adaptation to developmental needs and family preferences and values. So that isn't necessarily in the communication tool as it stands right now, because the communication tool that you're using is part of the curriculum that will come in the fall, the new curriculum. And in that case, the student learning outcomes have been updated. But what you do have is not necessarily a communication tool, but you have the caring tool where you take that into account. If you went to the CDC or ACDC, you have that available to you. And you also do, it could also be in the diversity tool. So being able to meet the student learning outcomes, I think is very doable, regardless of the setting that you're in, knowing that we're trying to get you to the bedside as much as we can. The other thing to look at as well are the course objectives. Again, we map these out. The excuse me, series, practice safe nursing care to 1 to 2 patients. Excuse me. I've been talking all day. To 1 to 2 patients, right? Taking into consideration patho, pharm, nutrition, growth and development. Check. Apply the nursing process. Check. Integrate knowledge of legal and ethical principles. Excuse me. In acute care and community settings. Again, that's met in one of your clinical portfolio tools. Utilize communication skills in the communication tool. Assume responsibility for the practice of nursing. That's competence. Act as a client-patient advocate, caring. And finally, incorporate age, level of development, and all that. Excuse me, and socioeconomic status of the childbearing family. You're doing that throughout this semester in PEDS and OB. So I think it's safe to say that as a group, you will, as a class rather, you will be able to meet the student learning outcomes and the course objectives. So hopefully that puts you at ease a little bit to know that will be happening. So what I would hope that you today and the rest of the time that's available, this video and the first video should take up about an hour of your time, is I would like you to continue to work on your portfolio tools. Excuse me. And the clinical, start working, pretty sure you haven't started, but if you have, good for you. But start working on that clinical evaluation tool in detail, bringing up specific patient examples, referencing your clinical tools, work on your care plan, care maps, and then also start working on that e-portfolio in terms of portions that you need for that. What I will do, it's our announcement, is excuse me, come back around at the time that you've designated for us all to get together and talk what you've accomplished, what you've learned. Shouldn't be more than an, and then I can schedule individual meetings for Wednesday as well. So what are we going to do on Wednesday? My understanding is that Dr. Nadwaza and Mr. Spinas have moved the instead of the skills hands-on midterm, oops, almost spilled my tea, are going to do the asthma week, and so I believe they're going to do the asthma pneumonia VSIM. So what I was hoping that we could do, I can walk you through the ATI cystic fibrosis real life scenario and also the asthma scenario. So we work on that as a group tomorrow. I mean on Wednesday, and I will post instructions for that, as well as the communicator piece of it. And then I will make individual appointments with you to go over any tools, answer any questions prior to your evaluations next week. So for next week, I'm going to talk to Ms. Dominguez. Originally, we were supposed to all be on campus. We can potentially do that in small groups so that we could stagger it through the day so that maybe 2 from your group, from our group, and 2 from her group can meet and talk about patients, maintaining that 6-foot distance. And then we can also be doing your clinical evaluations. Please let me know. No, I don't have COVID. This is my asthma and having talked all day on Zoom meetings. So please let me know if you have any questions, and I hope you have a great day. Thank you.